record of.
We're going to go live right now. Premier Doug Ford and Health Minister Sylvia Jones, they're announcing an investment of $30 million in Windsor Regional Hospital and taking questions from reporters. Let's listen in.
I have to tell you, the people of Windsor were ignored for decades. There was a lot of talk down here, but nothing was getting done. Because, the great leadership right to the left of me, I mentioned 4 people, now there's many more that live in Windsor. They're getting that new hospital. They're getting the investments like we announced today. Great investments from LG and Stellantis, making sure that other companies are coming here. We have some future exciting news about creating jobs, but we're building new schools, building bridges and roads, and expanding Highway 3. So I don't know of another government that's shown more love to the people of Windsor, and it's been long overdue than what our government has done.
Hi, Mr. Premier. It's Dale from CBC News.
Hi. How you doing?
I just want to ask you, what do you say to your the detractors to your plan to use private clinics that say that it's going to siphon off nurses, siphon off other staff away from the public system?
Well, the detractors, for the most part, are the ones that created Hallway Healthcare for many years. They're the ones that refused to build the hospitals, not only here in Windsor, but other locations. We're building either brand new hospitals or additions, 50 locations throughout Ontario. We're putting in excess of $40 billion in there. We're hiring more nurses. We're building universities for students to become a doctor. And we're just really pouring the resources. But do you know what we're doing differently? As the previous government was fighting with the docs, we signed the quickest deal with OMA that I've ever seen in recent memory. We always consult with the CEOs. I'm a strong believer, and I've said it a million times, I'll say it again, I'm not a healthcare expert, but people like David and his team and other healthcare workers around the province, we communicate all the time with them. They're the experts. We take their lead. And changing healthcare in Ontario should never, ever come from a politician. It should come from the frontline healthcare people that deal with the needs of people in Ontario day in and day out. And that's exactly what we're doing. And I'll tell you, I keep pumping up David and the mayor, because it's true. I travel around the province. These 2 guys are doers. They just make it happen on all fronts. No matter if it was the partnership with the mayor and our local MPPs about getting Stellantis or building this new hospital. I'll tell you, you guys have really incredible representatives down here.
And just on another topic, the City Council just authorized the use of 2 new gas turbines to generate some power at Capital Power, and it needs provincial authorization. Is your government going to be authorizing those to go online to produce electricity?
Well, I haven't had the opportunity to sit down with the Minister of Energy, but we will do that. Sit down with them, have a good discussion, and weigh out the pros and cons like we always do. It's very simple. If any decision we make is not good for the people, don't do it. If it benefits communities and people, and no matter if it's the healthcare or jobs, then we do it. And we go all in on it as well.
Hi, morning with Blackburn News.
Hi.
So we've heard from Dave Boucher about the success of the Cataract Clinic, moving it off into this private clinic. We've heard from you that people are not going to be using their credit cards at these clinics. Does it cost the province more to offer these services at private clinics than at a public facility? Are you offering these private clinics more than what you are offering hospitals?
Well, that would probably be best for the minister, but our whole goal is to make sure no one ever pays with their credit card. They pay with their OHIP card. But there's so many endorsements from healthcare professionals and CEOs of hospitals saying, because we're going to be partnering with the hospitals, it's not going to be standalone, and we're going to work hand in hand with these independent health facilities. But what it does is just takes the load off the backs of hospitals to free up time in the operating room. And I use this example, I use it again with my mom when she needed a hip replacement. And any senior, you don't have to be a senior, if you need a knee replacement, hip replacement, cataracts, you know how much pain they go through day in and day out, the discomfort these people live in as they're waiting months and months, to get help. It's unacceptable. We're going to make the change and get the backlog down, and we're going to continue all working together to make that happen. I'll pass it over to the minister.
Yeah, thanks for the question. So a couple of pieces that are important to note. With our community surgical and diagnostic centers, we do have almost 900 operating in the province of Ontario, and we have a formula for compensating that is based on patients that are served. This is really about access and making sure that patients who are waiting for critical surgeries, as we've mentioned many times, cataract right now is the longest wait time, and those are people who can't be as active in their community, in their workforce, with their family as we want them to be, and they want to be. So this is about access and making sure they have expanded access. As you know, here in Windsor, Essex, already we have announced the expansion of the cataract license, which will mean that those individuals who have either had to wait or been paying privately are now going to be able to access that same service with their OHIP card. It's very exciting news, and it is really game-changing for the people who've been waiting too long, frankly, for these very important surgeries and procedures. Thank you.
Dave, do you want to give your perspective?
Yeah, so I know there's some out there, as the Premier indicated and Deputy Premier indicated, that are, quote, skeptical to the idea. You don't have to look far to see that it works. It works in Windsor, Essex. We've had it up and running for close to 3 years, where patients that need cataract services are available.